Magic 89.9.
You're tuned into Healthline on Magic 89.9, your weekly dose of wellness, fitness, and everything in between. I'm your host, Tina Ryan. And for the next 2 hours, we're diving deep into the things that keep you smiling and strong. Kicking off hour one, we're talking smiles, teeth, and total oral care with none other than Dr. Jonas Apostol of Apostol Dentistry. Then in hour two, it's all about the burn, baby. Coach Mark Banta of Gymbassy joins us to help you get moving and stay fit. So let's do this, you guys. For now, though, let's get back to more of the music. That one's from Rihanna. Here we go. Something from Halsey on today's best music.
Magic 89.9.
Today's best music, Magic 89.9. Home, to me, is magic. Yeah, my home since 1994. Hi, welcome back. Again, it's 6:24 here on The Magic. This is Healthline. My name is Tina Ryan. It is now time for me to introduce our first guest. So if you're ready to smile a little brighter tonight, join us here on Healthline, a true expert in turning everyday smiles into absolute stunners. He's the founder of Apostol Dental Cosmetic Center and a master of both oral health and confidence. Please welcome Dr. Jonas Apostol.
Hey, thank you very much.
I love it that you're here, Doc.
It's my honor. It's my honor.
It's our pleasure also. So, Doc, I know you're super popular online. Oh, talaga naman, di ba?
Di naman.
Videos are always trending. Ito, Doc, for my first question, be honest. Have you ever skipped brushing your teeth before bed?
Before bed, I think seldom. Let's say in 365 days in a year, baka 2 beses
Oh,
siguro.
my goodness. Oh,
Or
wow.
dalawa or one. I don't know.
Okay.
Yeah.
Okay.
Yep.
By the way, we're live on playback.tv/magic899 if you have any questions for our dentist guest tonight. Hi, Christian Dom. Also, I think I can work the phone lines. 863-10899 if you have any questions for Doc Jonas. What is the weirdest thing someone ever asked you to do to their teeth, Doc Jonas?
Weirdest?
Meron ka bang
Mayroon ba? I think weirdest, madami no? Madami. Sa sobrang dami, parang common na yung weird na pinapagawa. Pero sometimes like they're asking me to create something na hindi babagay sa kanila. Diba, I'm an expert in veneering.
Yeah.
Sometimes they're asking for too long of a veneer, which I find it too weird because we are trying to create a smile that should be in harmony with the face. So minsan hindi siya harmonious sa the face. Yeah.
I love it. Hindi siya harmonious sa ano.
Pinaka-white tapos the rest.
Yeah.
Oh, wait. Miss Elaine is the beautiful missus is with us tonight. Okay. Whispering something. Ano yun, Doc?
Ayun.
Meron nag-request ng teeth whitening ka?
Ayun, hindi. Few years back, there's this one guy asking for a super crazy white crowns on his 2 front teeth. Dalawa lang.
I wonder what the purpose is.
I
Miss
am
Elaine,
not
what do you
sure.
think is the purpose?
It was weird.
Okay, so
Super.
let's just go back to how you even got started. Did you already have a passion for dentistry growing up, Doc? Like, was that you're like, oh, I want to be a dentist and a cosmetic one too? Parang ganon.
Yeah, wala. Hindi, wala. Never had any idea about this business and profession. It's more of like the bunot thing and the cleaning and the pasta thing. Yun lang yung alam ko about dentistry. But then, I really wanted to be parang sa food industry or music. Dalawa lang yan. Either you go for music, kasi may liga ako sa music eh. So typically, yung parents, ayaw nila ng mga ganong setup. Huwag ka mag-music. Kasi during
kasi mauwi sa banda or ganon.
Yes, 90s. I mean, di ba, 90s, early 2000.
Yeah.
Yung mga parents before, parang hindi pa nila nakikita yung the boom part, yung maayos na part ng music and pagiging chef. So, I went to the school and then I saw a 2-year pre-dental course. 2 taon lang. So it's a pre-dental course. So I thought, after nun, I can do whatever I want. Yan, di ba?
Okay.
And then, hindi ko alam, may 4 years pa pala.
Napasubo na pala.
Napasubo tayo. Yeah. But along the way, when I entered dental school, doon ko na na-develop yung love and passion to do dentistry. And during that time, parang gusto ko maging oral maxillofacial surgeon. Parang siyang...
Whoa! That's okay. In layman's term, that is
It's like a plastic surgeon, parang ganon, na dentist, parang ganon siya.
Okay.
It's beyond dentistry, but also facial. Hindi, yun yung gusto ko dati. But God led me to aesthetic dentistry. Kasi feeling ko siguro, I'm sure He knows my capability and kung saan ako mag-grow. So nilagay niya ako dito. That's why aesthetic dentistry is really my passion. And it's not like nagkaroon lang siya ng thing na I really want to be aesthetic dentist. Parang I cultivated it Cultivated it for years.
Nice.
Yeah.
863-10899. For those of you just tuned in, Healthline is the new show on Wednesdays. We talk to medical doctors, wellness doctors, all about your health. Okay, Dr. Jonas, he's a dentist. If you have any questions, please call us or via playback. .tv/magic899. Hi, Showbiz Bro! Nandito ako dahil kay Tina Ryan. No.
Yes.
Number 1 fan. Then number 6 fan. Love you, Makoy. Doc, ilan ba ang... Okay, how do I say this? Like, ilan ba ang... Di ba yung mga... Sa medical world, iba-iba yung mga doktor. May pedia.
Specialty.
May, yan. Ilan ba ang specialty sa dentistry? Madami rin.
Madami
Okay.
na. Parang more than 8, 9. Ngayon, mas may mga subspec na eh.
Wow.
Like microscopic laser dentistry.
Oh.
Ang dami na. Like me, I took up aesthetic and restorative dentistry in Germany. So it's
aesthetic and
restorative dentistry.
Okay.
Yeah. So, iba-iba.
So, when you say restorative, what does that entail?
Parang we restore teeth using the dental materials.
Okay.
You know, it's more of like building the teeth from ground up.
Oh.
No, yun. Tapos yung aesthetic part naman nun is we are creating something that should complement the face.
Oh.
Yes. Hindi siya yung parang build ka lang ng build tapos hindi pala bagay.
Oh my gosh, so may symmetry din ba yan?
Symmetry, yes.
Oh,
architecture,
okay.
yes, something like that.
Yeah, because I know this. Parang ayoko na itong kwento. No, I know of this celebrity. She's like the nicest face. But for some reason, she, like her teeth are kind of just like,
Super
parang
big.
super liit.
Super liit.
Super liit. So parang she has more gums. I'm not being mean. I still think she's beautiful though. So yun yung mga binabago mo daw.
Yes. We
Oh my
enhance that.
gosh.
Yeah, we enhance that.
Okay.
Yeah, for sure.
And so so if I wanted that's what I should start calling it. I want my smile or my teeth enhanced. So anong klase? Veneers? Ano ba yan? What are the crowns? Anong difference do?
So, madami tayong dental interventions when you talk about aesthetic and restorative dentistry. Number 1, you have your teeth whitening. If like non-invasive lang, gusto mo lang paputiin, it's a bit yellowish, something like that. It has its limitation, but this is like the very first form of cosmetic dentistry procedure wherein we don't need to reduce the teeth or something. Yeah. So number 1, teeth whitening. Number
That's
2,
the easiest. Okay, teeth whitening.
Number 2, we have the direct composite veneers or yung we use a composite to do it in the mouth. We have veneers like porcelain veneers.
But ang dami.
Ang dami. We also have orthodontic treatment because sometimes we have to make sure that we collaborate with other specialty in dentistry to make sure that we correct the bite, the teeth, the symmetry, the bone, even the gums. So sometimes we cut the gums first.
Oh yeah, it sounds painful. Okay.
It sounds painful. Yeah. But we have to cut the gum first. We lift the gums and then followed by putting some veneers. But it sounds easy, but it's not easy because sometimes it requires time for us to get that beautiful smile, but it's still healthy and functional. at the same time, it's beautiful. Beautiful. Yeah.
Showbiz bro si Vilma. Sinong Vilma ba yan? Isa lang daw. Sino ba? Talaga? I'm not... Bakoya. Maddie, Doc, nare-reshape ba ang gums?
Yeah, of course, definitely, 100%, yes.
Joke kasi, Tito Joke. Vilma Santooth daw. Okay, we're leaving. Bye, guys. Okay, Bakoya! Mamaya na yan. Past 9 na yung mga Tito Jokes. We love you.
Oh my.
For those who just tuned in, 6:33 here on The Magic, we have Doc Jonas Apostol. He is a dentist, specializing in a lot of things. If you have any questions, please feel free to call us or leave it on playback.tv/magic899. Doc, if your smile had a theme song, what would it be?
Wow. I want it that way.
No! Wow! Mga Backstreet Boys! Mga Backstreet Boys. 98 degrees ha, nandito. Mga boy bands. Ha?
Really?
This weekend they're
Oh my
here.
gosh, they're my favorite.
Edgar Mortiz. Ano ba? Showbiz Bro, I love you. Ayan, kung kailangan mo ng guest. Showbiz Bro runs the longest running comedy podcast in the country, in the Philippines. I'm very proud of this guy. So, i-guess na natin si Doc. Okay?
Let's go.
You get one dental tool to bring on a deserted island. What are you picking?
What? Sorry?
A dental tool. Ang dami naman nun.
Deserted? Oh my God. I think...
May favorite ka ba, Doc? Sa
Yeah.
mga... Ako, parang feeling ko yung oxygen.
Laughing gas.
Laughing gas. Yun ang favorite ko. Joke. Okay. Ang daming dental tools, di ba, Doc?
Ang dami. Pero siguro, I just wanna be practical. I'm gonna use my dental elevator. A U3D one.
I'm sorry, what?
Dental elevator. We use that to elevate the tooth when we extract the tooth. Syempre, it's a deserted island.
Okay.
We don't have anything there.
How big
So
is that thing even?
It's like this. Para sa screw
Okay.
driver.
Oh.
So, double purpose yan for protection.
And
Yes.
pang open ng...
And for dental surgery.
Oh, nice.
Yes.
Akala ko pang abrilata na rin, Miss.
Pwede din.
By the way, I'm wearing the jacket pala, Makoy. Oh, Machong Chismisan. The longest running comedy podcast. Ayan po. Thank you sa pa-jacket. Binigyan ako ng jacket. Bigyan mo rin si Doc. Makoy. Who do you think has the best celebrity smile in your opinion?
Male and
Give me both.
I think sa male, Sam Milby.
Ooh.
Yeah, Sam Milby.
Okay.
Sa female naman,
International.
international ba? Any? Female, Christine Hermosa.
Okay. And not natural. Tingin mo, Doc. Natural. Okay.
Natural.
Doc, true or false? Dentists secretly judge your teeth while talking. Doc, is that true or false? Do you do that? Do you judge people's teeth while they're talking?
Personally, paano ba? Tapos sasabihin ko, syempre, disclaimer yan eh. Hindi ako judgmental eh. Ganun.
Oh, wait, may funny story ako. But go ahead, Doc. True or false?
Yeah, true.
Okay.
Depends on the dent. Pero yeah, 100%. Kasi it's our job to check the gums, the teeth, the mouth inside.
my.
Yeah, it's our job.
Oh, my.
Yeah.
So, one time, Doc, I hosted a birthday party.
And then?
Tapos hindi ako nag-ayos ng buhok. Kasi sobrang tamad ako talaga, Coach. Promise. Ipupusod ko lang siya. Lumapit sa akin yung hairdresser. In-sponsor ako. Pumunta na lang daw ako sa Oh my God. Okay. Oh, so have you ever been in a conversation, Doc? Tapos medyo yung kausap mo, I mean, not that I'm being mean or anything, medyo talagang bad yung I guess yung itsura ng teeth niya.
Okay, of course, 100%. Dami.
Were you able, did you have the, pangit sabihin ko, So did you have the balls to talk? Did you really tell that person?
No,
Okay.
hindi. Kasi I'm a respectful guy.
Okay.
We really have to respect. Kasi at the end of the day, it's different culture,
Yeah.
different background. For some, let's say for some culture, they don't care about the teeth. It's not
Yeah.
important. So for me, I just need to to respect them. Kung ano man sila. Wala. Hindi. Wala. Unless they would need my, diba, expertise.
Yeah, your recommendation.
Yeah. Yep.
Okay.
Relax lang.
But so has anyone approached you? Because that person knew that you're a dentist. Nagpabigay na sila ng honest opinion mo about their smile.
Yeah, for sure. Oo.
Okay.
Oo. Minsan, casual lang. Kasi beauty kasi for me, it's always subjective.
Oh, that's
Let's
true.
say, may sungke. But it's not really the teeth per se. We have to look at the whole personality thing. We have to look at the face, the shape and everything. May mga iba kasi na they don't have like a nice set of teeth pero bagay sa mukha.
Oh,
Diba?
yeah.
May ganun.
Oo.
So you just have to compliment them kung ano yung maganda. Yeah, ganun lang.
Doc, what is your take on fluoride? This is coming from Emmy.
Fluoride is a good thing.
Okay.
It's a bad thing if you take a lot of fluoride though. Sa lahat naman, pag madami, masama.
Okay.
Kasi it can cause fluorosis or it can cause demineralization of the tooth structure. So you have to be very, very careful when we do that. But one of the reasons why it can damage the teeth, yung madaming fluoride, is through water content. Hindi yun yung topical lang. Kasi pag topical sa toothbrush mo, konti lang yan eh.
Okay.
It's not like medical grade fluoride eh. So konti lang yan. Kahit isang ganun pa, isang ubusin mo pa yan, it's not like super crazy amount of fluoride.
Okay.
So for me, it's a good thing.
Okay. Hi, Ali. Dental technician here. Ali is a dental technician.
Oh, wow.
Wow, hi.
Hello.
Hey, even dental technicians in the US make a lot of money. And it's not an easy career to get into, I heard. Doc Jonas, what are the most common dental problems you encounter in your practice?
Well, before, more on tooth decay.
Okay.
Like common, 100% common.
Okay.
And then impacted teeth. Kasi I used to do a lot of dental surgery.
Impacted teeth in Tagalog is sungke. Hindi.
No, it's yung ngipin na they failed to erupt. Yung nandun lang siya sa loob.
Oh, tas naging wisdom tooth ba yan? Oh
Yes,
my
yeah.
gosh. Like Sam, our very own Samo, our morning crew, she just had her wisdom tooth removed. Like she was in the dental chair for like hours. Okay. I'm
Yeah.
so happy I don't have mine yet. Okay. Here we go, 6:41 here on The Magic. This is Healthline for those of you who just tuned in. We have Doc Jonas Apostol of Apostol Dentistry here with us. So if you have any questions, please send them our way. Can you talk about the connection between oral health and overall health?
Oh, wow. Yung mga most common questions ngayon. Well, with a compromised gums, let's say for example, you have a bleeding gums. The bleeding gums could potentially, if left untreated, it can cause periodontal problem.
Okay.
So the periodontal problem, it's not like the gums and the teeth. It's more of like the bone that holds the tooth and the teeth and the gums. So if there's like a dental infection, okay. So if there's dental infection, because our body, syempre may parang circulatory system.
Yeah.
So if there's an infection in our mouth, it will always go back to your system, like your heart, your lungs, your brain. So it can lead to some sort of infection to not just the mouth, but also to the bloodstream. So we have to be very, very careful when you have infection in the mouth because it has a direct correlation to our system. So yun, isa pa lang yun
But so bleeding gums, when should we be alarmed? Like weeks na nagdudugo pa, ganun ba, Doc?
Alarmed if it really depends on the reason, the cause of the bleeding gums because it's multifactorial. You know, we can't say that there's a bit of a bleeding. It can cause infection kaagad. Sometimes it's just like inflamed lang because of some sort of bacteria or plaque embedded on some sort of the parang sa may under the gum. That's the reason why there's an inflammation. But it's multifactorial. I can't like pinpoint talaga kung ano. Pero kung may mga symptom ka na ganon, you have to visit your dentist for you to know what's causing it.
That's true.
Yeah,
Okay.
we have to run the test sometimes.
Now, speaking of, the reason, Miss Elaine, why I couldn't go, you've scheduled me so many times. Doc, sobrang hiyang-hiya ako because I think it's been 4 years since I visited my last dental visit. Nakakahiya. So, what is the recommendation? Coming from a dentist, how many times should we visit our dentist, Doc? Tell everybody on Healthline.
So you have to visit your dentist at least every 6 months.
Every 6 months. Okay.
So when we visit your dentist, most of the time we should require an OPG or a panoramic X-ray for us to check the whole condition of the teeth, the gums, the bone that holds the teeth, lahat. Hindi lang siya, not just the teeth that we can see, because most of the time the problem is actually underlying nandun sa loob. That's why every 6 months nakikita natin. And also we have to check it clinically if there's a developing caries or cavity, decay, something like that. So isa yun.
So every 6 months, guys.
Every 6 months tayo.
Now let's go to listeners with kids. What age should parents start bringing their children to the dentist?
As early as 1 to
Oh.
So, yes.
Okay.
Pero not really, yung intervention na grabe,
Okay.
It's more of like introducing your kid to a dentist para at least masanay sila na, there's a tooth doctor pala who will take care of our teeth. Kasi if not, mahirap na. Baka if there's some dental problems, dental issues, tapos takot sila, it's gonna be more problematic.
Okay.
Kung hindi sila, kung takot sila sa dentist.
There you go.
1 or 2. Yeah.
Now, Doc, what sets Apostol Dentistry naman apart from other clinics while you're here? Please do share.
Sets us apart. Well, I can't tell about other clinic, but Apostol Dental Clinic, Dental Cosmetic Center is a multi-specialty dental clinic wherein we have our own dental laboratory.
Nice.
We have our diagnostic machines. We have a pool of specialists like a periodontist, oral surgeon, aesthetic restorative dentist, myself, biomimetic dentist myself. We have a prosthodontist. We have endodontist.
I don't even know what a prosthodontist is. What's a prosthodontist? What difference in prosto sa endo?
So it's more on some dentures. Something
Okay,
like that.
okay.
Or, yeah.
Okay.
So we have a pool of specialist implant dentists. So we have that, and the experience that we have, and also the synergy as we work. Hindi kami yung parang kalat na pag mag-work kami, we know that we have a goal, and we always prioritize the patient rather than ourselves.
Nice.
Yes.
Awesome. And I know you also have a foundation recently. Please do share, Doc Jonas. You guys did tooth extraction. Where was that?
So we conducted that libreng bunot
Yes.
sa clinic namin mismo.
Oh, I wanted to stop by, bring you guys pandesal.
Oh, wow. Yeah.
Diba? Pandalitos. How did that go? And how often do you have that?
Usually we conduct missions outside the clinic. It was actually our second time to conduct it in the clinic. The first one was with Bahay Ampunan. Syempre hindi lang namin masyadong na-highlight because bawal sila mapunan.
Yeah, because they're kids pa.
Yes.
Yeah, minor de edad. Okay,
Minor de
got
edad.
it.
And then the second one, yung latest, yung libreng bunot. Which, it's not actually like bunot lang. We did surgery of wisdom teeth.
Whoa. Oh,
Yeah.
okay.
So medyo madami kaming ginawa, and then yun, it was really good. We had like 60 patients. Yeah, 60 patients.
Wow. Congratulations. You guys were busy. Okay.
Thank you. So we let them experience everything, like the procedure itself, under PPE, free medications, free ice cream after.
Yeah, that's my
Yep.
favorite part about going to the dentist when I was a kid. Oo, kasi may ice cream. May pa-ice cream eh.
Yes. So yun.
So,
Okay naman, masaya.
congratulations
Thank you,
again.
thank
And
you.
we do hope the nonprofit Peace Org that I volunteer for, we hope that we can
Yep.
collab with you guys. Mag-volunteer kami. Doc, what do you want our listeners to take away tonight? After listening to you, what's your message to them regarding oral health?
Just remember to brush your teeth at least twice a day.
Floss. How about floss? How often should we floss, Doc?
Pwede na once. Pwede na yun.
Okay.
Yan. Mouthwash, as long as there's no alcohol content,
Okay.
pwede na yun. Why wala dapat alcohol? Because alcohol can dry our mouth, and if our mouth is dry, the proliferation of bacteria would be rampant. So we have to make sure that there's no alcohol. Yun. Also, you have to visit your dentist every
6 months, you guys. Every 6 months. Ayan. Doc, how can they find you? Your socials? These tests, by the way. Hi, Doc Jonas. You have a clinic near South area. I'll be coming back this June in the Philippines. Mahal kasi dito sa Rome ang dental procedures. Are you opening up one? Not yet.
Only in Makati.
di Makati. Makati lang po. Makati lang tayo. So our clinic located at Steven Street,
They have a beautiful clinic, you guys.
Legazpi
I
Village.
feel like a beauty queen every time I walk in there, Coach Mark. Promise. Oo, feeling ko talaga Miss Universe ako. By the way, Doc,
Bumalik sa Melbourne.
diba?
Naginis ako.
Yes.
Ayan na, I refer to cost. Doc Jonas, actually, ano ulit sa Miss Universe Bahrain, tama?
Yeah.
You're the national...
Co-national
director.
for Miss Universe Bahrain.
Oh, kita mo?
Yep.
Parang timing yung mga guests ko tonight. Trainer ng mga Miss Universe. Dentista ng ano. Is that a sign?
Pakita na.
Is that a sign that I should visit you guys? Oh my gosh. 6:50 on the show. Doc Jonas, again, your socials. Social media.
Social media, we have an Instagram account, Apostol Dental.
Facebook.
We have a Facebook account.
Makati Dentist.
Yung asawa ko yung mas magaling
Oo nga,
dito.
bukas naman yung mic
Yeah.
ni Miss Elaine. Yes, please.
Hi guys, good evening.
Yun! Super supportive. I love it. See, Coach, you should have brought your wife. See? Okay.
Pahabol.
Next time, they'll bring baby Tasha. Oh my God, they have the cutest baby. OMG. Next time,
You'll
Doc,
just shout.
social media pages,
So we
please.
have an Instagram account. It's at Apostol Dental. We also have a TikTok account. Same at Apostol Dental. YouTube as well at Apostol Dental. And Facebook, Makati Dentist by Apostol Dental.
Perfect.
Yay! So,
Thank you.
so much. Doc is gonna cross over to our sister station. Please give Ro a big hug for me. I will stop by after my show. So,
Sure. Thank
Doc
you.
Jonas
Thank you for having me.
of Apostol
Thank you.
Dental, Miss
Thank you
Elaine,
very
thank
much.
you so much. We'll have to see you again very, very soon.
Yes.
Very soon. Thank you.
And don't leave just yet, okay? Because I know you're stuck in traffic anyway. I've got another special guest. Coach Mark is coming through in next hour, so please do not go anywhere.
Magic 89.9.
Today's best music, Magic 89.9, Slot Machine and Skyline. It's 7:18, second hour of Healthline with yours truly, Tina Ryan. And yeah, papanindigan na ang pagiging healthy just because I'm hosting this new show. Joining us tonight, someone who lives and breathes fitness. He's a certified coach, a transformation expert, and the driving force behind Gymbassy. Based in Australia and only here in the Philippines for a month, he's making the most of his visit by inspiring others to live healthier, stronger lives. Please welcome Coach Mark Banta. Hi, Coach. Hi.
Hi, Tina. Thanks for having me.
Oh my gosh, you know what? I'm just so happy that you're in the country because you are busy. Okay, Coach, alam mo naman kung gaano kasama ang traffic dito sa Manila ng ganitong oras. So I'm sure a bunch of people are probably this close to losing it. So for my first question, which I sent... Wait lang.
Sige lang.
Ito na. Ay, sorry, hindi pala to. Ito, for the first question, Coach Mark, here we go. Do you get road rage? Or are you one of those calm, deep breath, inhale types of guys since you're in the, I don't know, fitness industry?
I'd say ngayon medyo relaxed na ako eh. But before, siguro mga early stages na nag-drive tayo back in, say, high school, college.
Oh.
Yeah, medyo, ano pa yan eh, mainit pa ulo natin. Pero,
Ibang time yun.
yeah, ngayon medyo relaxed na, especially having a daughter, di ba?
Yeah.
Very observant din sila eh. So, I want to set a
good
good example,
example.
di ba, sa kids natin.
Yeah.
So,
I like that.
chill lang ako ngayon, binibigay, kahit ma-overtake, wala na sa akin.
So, Coach, alam mo yun, a lot of our listeners now are literally not moving. What's one thing they can do, meron ba, in the car to stay loose or even sneak in some fitness? Is it even possible?
Since like very tight space yung car, you know, I would suggest siguro just fixing your posture, especially just being stuck in traffic, say 30 to an hour ba yung biyahe natin, diba?
More.
So by, sticking your chest out, retracting yung imagine yung scapula, you squeeze your scapula parang by keeping your back straight, just correcting your posture, it will bring you more say clarity or yung blood flow natin as we drive, di ba?
Okay.
So yung thinking natin, we're more alert as compared to sa nakaslouch ka lang, di ba?
yeah. Oo.
So, yeah, ako malaking bagay na yun kasi over time, yung mapapansin mo yung posture mo, naging rounded yung back, di ba? Yung forward tilt ng head.
Yeah.
natin.
Is that something that gets corrected as as we work out? Like, nako-correct ba yun?
Yeah, there are corrective exercises. Yung papapansin mo kasi every time you do, say you ride, you cook, you drive, everything that we do, 80% lagi we move forward, di ba?
Yeah.
Wala naman tayong movement na we look back, pabalik eh.
Oo.
So, ang nangyayari sa atin over time, nga nag-round yung back natin, nagtitilt. You observe yung mga older people, di ba? Lagi silang
nakuba
na,
yes,
di ba?
oo.
So, yeah, malaking bagay yun. Even just doing it 10-15 minutes every day, or kapag, especially desk job, di ba?
Yeah.
Yeah, yung postural assessment lang, you can do that if you have a coach. Yeah, one exercise I suggest.
And also, Coach, there is a, it's somehow related, diba? Bad posture sa back problems.
Yeah.
Yeah, so I'm not even kidding, guys, when I say, hey, correct your posture because in the long run, you're gonna have a screwed up back like me. So again, posture is key. For those of you just tuned in, this is the second hour of Healthline. Fitness for busy people, Coach. I only have 15 minutes a day because I'm so busy, whatever. And I'm tired from work. Lahat na lang na excuse, Coach. 15 minutes a day, Coach. I'm tired from work, traffic, and life. What workout should I be doing?
Yeah, 15 minutes, no? Say ang client natin, yung listeners natin, more on mga motorista, diba?
Yeah.
Motorist. So, ako ang style ko dyan, by simply parking your car, mga 5 minutes away sa destination natin, which is 200 to 250 meters siguro. Without you knowing it, di ba, parang naglakad ka na rin. So, every day, gawin mo yun, you park 500 meters away, tapos, going back, that's extra 1 kilometer walk na eh. So, if you have 15 minutes lang every day by doing that, or something that you enjoy, don't be overwhelmed sa mga exercises that yung mga nakikita natin sa Instagram that they have to stay like an hour. Do something that you enjoy. I would suggest if you wanna dance, Pilates, yoga.
Yeah, dance videos too. Speaking of the internet, Coach, have you seen workout videos that are just whoa, nag-trending, but it's you personally, parang it's not like the best?
Yeah. Alam ng coaches yan eh. Ako, when I look at the video, hindi naman talaga siya something that you do every day.
Okay.
Maybe you do it for views. Yung nag-post man nun, I'm not sure. But yung intention siguro ng ng trainer
Yeah.
is to get more attention.
Okay.
But for general population, hindi naman talaga siya gagawin ng, let's say, 35-year-old desk job worker, di ba?
Okay.
It's not for everyone.
Okay.
Yes.
So how do we know if it's like a good video? Ano, based on, kasi di ba ngayon yung mga videos din, magaganda yung reviews. Well, like personally, what would you recommend? How careful should we be when following like, di ba, mga workout videos online?
If you're looking at the person na you look up to, if aligned yung ginagawa niya with your goal, say someone that you wanna be a bodybuilder, syempre you look up to a bodybuilder.
Yeah.
If you're a aspiring beauty queen, you look at the beauty queens and follow their program as well. So kailangan align din yung program na ginagawa niya sa program na right for you.
Okay.
So yeah, with your question, I think you have to also do your part.
Yeah, do your due diligence.
Tama.
This is the time I brag, no, Coach. You mentioned beauty queens. Coach Mark here just happens to be the personal trainer of Miss Pia Wurtzbach. Hello, Miss Universe lang naman. And who else, Coach? Come on, spill it out. Madami. Sino pa? Celeste?
Yeah, but sige, mag-start na lang ako siguro kay T para maalala ko clearly.
How did you even like start to train her? Like, how did it happen? How did you guys connect?
Back in 2015 kasi I started with Pia's best friend, si Carla Lizardo.
Oh.
Carla, thank you. To this
Hi,
day,
Carla.
To this day, very, very grateful and thankful ako na refer ako ni Carla. And then after that, maganda yung timing kasi Pia was looking for a trainer. And then Pia won. So we trained for, I think, 4 months. And then Pia won 2015.
So 4 months before the actual pageant?
Yeah.
Is,
I can still remember vividly lahat ng September ko siya na-meet eh.
Oh my
Close her
gosh.
birthday. And then, we trained till December before I flew to Vegas. And then, I think December 22 or 21 yata yung pageant niya. And then, after she won, and then there, it took off.
was there a moment yung pagkaalis ni Pia sa gym, parang, okay, she's ready to compete and she's gonna win it.
Yeah. Confident,
wow.
yeah. I'm very confident.
Oh my.
Yeah. And then, with your question after nung, when she flew, I trained si Maxine yata in 2016.
Nice.
And then after that, 2019 was Gazini Ganados. And then mga recent visit ko, I got to train Ara Arida, Celeste Cortesi for 2023. And then I think Janine Togonon,
Oh my gosh. Okay, countless.
to name a few. Yeah,
Countless of
Kylie.
beauty queens. Christian says, I got to check out Coach Mark's IG. Ganda ng katawan ni Coach. Sana daw all. Well, di naman overnight yan.
Thank you.
Diba? Medyo pinaghirapan ni Coach ng konti yan. Hi, JP! So, Coach Mark, what about people who haven't worked out in months? What's your step? I haven't worked out in years.
Like, sabi laging day one, always a day one.
Ano ba yun? Parang reset na naman, Coach. Ano ba? Anong advice mo sa mga tamad?
Ako start with baby steps. Kasi if you follow the program of your friends, tumatakbo siya 10 kilometers.
Hindi naman ako runner.
Kung di runner or sabihin natin sa gym lang,
Oo.
like an hour.
Yeah.
Medyo overwhelming for a beginner yung 1 hour workout
Yeah.
for like 4 or 5 times a week.
Yeah.
So start with baby steps. Siguro mas gusto ko ang style ko sa clients ko is gusto ko yung nabibitin sila ng onte or yung tamang-tama lang. So ang response kasi ng brain mo is hindi siya something na daunting task na yun na yun, day one pa lang. So hindi talaga siya sustainable for the long run. So mas gusto ko na parang, tapos na. Mas excited ka sa next di ba?
Yeah.
So start with baby steps. Yung sabi mo, if you only have 15 minutes. From there, pag bitin na yung 15 minutes, for sure, gagawin mo 20, then 25.
Okay.
And then yung twice a week, increase to thrice. Then then 4, and then 5. And then from there, mas magulat ka na lang, you're doing it for years. Tuloy-tuloy na siya.
Gosh.
Di ba? Tapos, mas maganda na sexy ka all year round as compared to meron ka lang 10-week, 12-week program. And then you look back at your pictures, parang, sexy ako nung summer.
Oo.
Diba?
Parang yun na lang ipabrag mo, no?
Yes, laging ganun eh.
Oo, yun ipapost mo. Sexy ko nung 2015. 2015 talaga.
10 years na, di ba?
Mark, there still is. They're back in their old time slot, 9 to 12. They're they're up after this show. Workout for on-the-go moms then from Joy.
Oh, wow. On the go.
Hi, Miss Joy.
On the go moms. Most of my clients are, some of them, young moms. Some of
Okay.
them are young moms. And mas gusto ko yung functional workout.
Ooh, what is a functional workout?
Functional workout is something that you do every day na yung tinitrain mo sa gym can translate to your everyday movement. Right?
Oh,
the way you function.
nice.
So,
Okay.
with moms, mas nagtitrain ako sa kanila na nagagamit nila like hinging. When you bend, you pick up something from the floor. Parang yung baby mo, di ba, kinukuha mo from the floor, then you carry.
Yeah, and there's a correct way to do that too, diba?
Yeah, exactly. And when you do presses, when you bend and then you extend your arms overhead, yun yung movement na you pick up something from the floor, tapos ilalagay mo siya ngayon back to the cupboard sa
Yeah.
shelf. Or yung baby mo, when you lift overhead, di ba? Or in groceries, you do farmer's walk,
Yeah.
where you have both weights on each
Equal
side.
weight.
Yeah.
Equal weight ba dapat?
Equal weight, mas maganda.
Okay.
And syempre, mas balanced ka nun.
Farmer's walk pala tawag.
It's like doing your groceries or everyday, di ba, like time you lift sa right hand,
Yeah.
say you have your baby on your right, tapos meron pang stroller or yung pram or yung cradle on your left hand. So that's something na pag tinitrain mo siya sa gym, pagdating mo sa everyday movement mo, it makes your life easier.
Nice. So may advantages pala mga mommies. Nagagamit.
Nag-shift na rin yung clients ko from Miss Universe. Most of them are young moms na eh.
Let's talk about your app. Okay, so this app, because, I mean, Coach is not here all year long. He's based in Melbourne. So the app finally, you launched it. When was this?
That was 2017, 2018.
Okay, and I follow him and I see the results of his clients all over the world. I mean, the transformation is just amazing. So, ano yun, Coach? Like, if I download the app, which is Jimbasi, tama?
Yep.
And then, may assessment tayo, di ba? Like, ano yun? May video call ba tayo? And then Coach, ito yung problema ko. Gusto ko lang lumaki tong shoulders ko or maging round. Mga ganun ba yung question sa'yo?
Normally kasi when you do your personal training with a one-on-one coach, like face-to-face, ang protocol dyan is we have to do our assessment pa rin.
Yeah.
We have to know your exercise history, your medical history. I still do that over the phone. And then from there, I can set a baseline kung ano yung fitness level ng client, ano yung mga stubborn areas that you want to improve. Also, ano yung mga concerns mo if you want to get stronger.
Yeah.
Ano ba yung pinaghandaan natin? Is it a marathon or just,
Aging ang pinaganda ko.
yeah, or rehab lang. But, I still do my assessment over the phone. And then from there, I'll be designing a program that will be aligned to your fitness goals. It's not something that, say, yung ginagawa ni Pia, it's not for everybody, di ba?
Okay.
Hindi naman lahat, pag nakita niyo yung program ni Pia, hindi rin biro.
Babagay, yeah. Oo.
Yeah, like 6 times. Nag-train kami. This is, prior to the Miss Universe pa.
Yeah.
But imagine training 6 times a week and with a diet. And then mom ka. Siyempre, your energy levels by mid-afternoon,
Yeah.
moody ka na. Tapos yung baby mo,
Oo.
doon mo iyak. Hindi talaga siya for everybody. So for every client, I design a program that will fit your lifestyle and your fitness goals.
So if like how do you stay on top of your clients then kasi 'di ba minsan are they like super honest about missing parang missing the program, 'di ba? Paano mo tinututukan? But to see the results, 'di ba?
Like one-on-one or my online clients?
You're both online and 101.
As much as possible, I do my part. Kailangan mo talaga silang kumustahin. You have to check. And I trust my clients as well.
Nice.
Siyempre, kailangan coming from them if they say yes. But sometimes, hindi ba rin talaga may iwasan. Pag sabi nila na, Coach, ginawa ko yung workout, but yung diet part, yun yung challenging eh.
Because tama ba yung Coach? 80% ba diet? Tama ba
Could
yun?
be 80%, could be 70 or
Okay.
90%.
But the diet plays a huge role.
It should be 100% diet, 100% din workout. If you want to see results, go 100. Wala na mo ng 80-20. But yung most part talaga yung nahihirapan sila sa diet eh. If you want to see results. Lahat kaya mag-workout ng 3, 4, 5 times eh.
Yeah.
But yung diet part, imagine that's 23 hours outside the gym.
Yeah.
Right?
Uh-huh.
Ang workout is only an hour or maybe 1.5.
That's true.
After that, you're on your own, 22 and a half. mag-isa ka, di ba?
Oh
Yun ang
my.
challenge. Wala na ako doon. So, yun yung discipline eh.
Ito, Coach, mainit-init yung question, no? Thoughts on working out to get over heartbreak? Hahaha, sustainable ba, Coach? Diba?
Ganda naman eh.
Galing, heartbreak, diba? Pa-sexy ka na lang, diba? And then flaunt it. Meron ba, Coach?
Ako, pag nagtanong ako ng clients ko ng goal nila, top 2, either ikakasal sila or atin ng wedding, or yun nga, may tawag nila dyan, revenge.
Revenge body, mga
Parang ganun eh.
ganun.
Yun yung kailangan nila, may something to prove. Pero ang ganda ng results. After nga lang nun, syempre magkakaroon silang bago, di ba?
Oh, tapos
And then yun na
magiging
ulit.
complacent na naman.
Oh,
Diet.
pero
Kasi, di ba, mahilig sa ice cream yung bagong boyfriend. Parang gano'n.
Pero in terms of motivation and dedication, especially pag heartbroken, ang ganda talaga ng results. You don't have to push them.
Yeah.
Kailangan mo lang, parang ride the wave ka na lang.
Motivated na
You just
sila.
have to give the right program. Pero, hands down, ang ganda. Ang ganda ng talo pa yung sumali sa Miss Universe.
Coach, may umiyak na ba habang nag-workout? Dahil pagod na, tas heartbroken pa.
Umiyak.
Pinahirapan mo pa.
Hindi, wala pang umiyak. Pero alam mo yun, parang tulala sila sa window.
Oh my gosh, that's even worse.
Alam mo in between sets, alam mo talagang ang lalim na iniisip. So, sometimes from being a personal trainer, you have to be parang psychiatrist ka rin. You have to be...
You have to motivate them. Oh. Okay, na-mention mo na din naman, Coach, yung snacks kasi ang hirap nga kumain. Yung part nga ng diet, diba? Traffic equals snacks. Chips, milk tea, those sugar-coated peanuts at the gas station. Ano bang better option, Coach?
Better option?
Yeah, better option. Like you personally, like...
Ang style ko pa rin kasi with a client, I don't give the exact recipes or yung food. Kasi I might mislead some of our listeners. If I say apple, di ba? Fruit yun, healthy.
May sugar ba?
yeah,
Sasabihin mo may sugar yun.
Yeah.
Oh.
At the end of the day, kung kumain pa rin sila ng 3, 4 apples, healthy man yun, it still accounts to calories eh, di ba?
Yeah.
So, ang ginagawa ko sa clients, kung ano yung favorite nila na food, kasi you can go 0 to 100 right away. Mas gusto ko yung sustainable. So, kung may client ako, ang favorite niya is milk tea. Sabihin ko lang from large, gawin lang niya medium. And then from there, medium from 100% sugar, yung medium gawin natin 50%.
Yeah.
I'm not saying it's healthier, but lesser evil. Diba?
Oo, lesser sugar.
And then
Oo.
after nun, yung mapapasin niya results eh. And then magugulat ka na, sa kanya manggagaling, Coach, okay na ako sa milk tea. From there, dun ko sila itatransition ng healthier snacks. Kasi hindi ko pwedeng tanggalin yung milk tea mo and then palitan kita, example, broccoli. Hindi, di ba? Parang, pwede mo siguro mag-go for a week or 2.
Nagre-rebelde ako.
Pero after siguro losing 5 pounds in a month, baka mag-rebound ka eh. Parang ganun ang style. Mas gusto ko talaga yung kung ano yung style ng client, I'll adjust.
Okay. Now, speaking of, ayun, yan, yung rebounding to, back to the weight. Ano ba talaga yung healthy weight loss in a month, Coach? Kasi yung iba talaga parang pinipilit. Hindi, kaya ko to 10 pounds. Di ba? They're saying it's not healthy.
There's a scientific way, yung healthier way of losing weight or gaining weight is like 1% of your body weight. Or even, siguro safe way is a pound or 1.5.
A week.
Ay, in a week. No, it's maybe 0.5 to 1%. So if ang client mo is 100, example, i-round off ko, you're used to pounds or kilos? Sabihin natin,
Pounds.
Pounds na lang, no? If you're, example, 100 pounds, safe way is losing 1 or 0.5 to 1 in a week. So kung may mag-lose man, example, ng 2 pounds, imagine in just 5 weeks, you lose 10. 90 ka na lang. Ang mangyayari dyan, pag tinignan mo yung friend mo, parang, yes, pumayat ka ng 10 pounds,
Pero
but every time I look at you, mukhang may sakit.
Mga bangkay.
Like,
Ganun.
mukhang anemic.
Yeah.
Diba? But yung 0.5 to 1, maganda yan. Imagine kung 150 ka, you wanna lose 50 pounds. In 52 weeks in a year, you lose 52 pounds. If you lose 0.5, that's 25 or 26 to be exact. So, minsan ina-underestimate mo rin 0.5 lang. But over time, in a year, yung 150 mo, 100 ka na lang.
Okay.
But hindi naman din talaga i-add ko na rin na hindi laging lose weight ang basis natin.
Yeah.
Don't be obsessed on what you see on the scale. Kasi if someone will compliment you, sabihin ko ngayon, Tina, ganda ng katawan mo Hindi ko naman alam weight mo
Oh.
Diba? Mas gusto ko na yun as compared to kunyari, dumating ako, tapos sabi mo, Coach, 90.
Yeah.
90, but you don't look healthy,
Yeah.
right?
So people tell me, oh, payat ka. Yeah, but I want to be strong.
But pag sinabi ko, Tina, sexy mo ngayon pero sa mo yung weight, yung scale nga, hindi ko alam. Wala nang may alam ng scale.
Oh, diba?
Tayo lang, ako, client ko, kami lang may alam ng scale. But every time I look at you, you look healthy, you're stronger.
Yeah.
And yung mood swings, maraming variables pa outside your weight.
Worst food to eat while driving, Coach, besides chips? Yun na yun. Or anything sugary.
Hindi, sugary nga actually, baka mag-spike pa eh. Somehow, yung alertness mo mag-increase eh. But for
Pero
me,
you get a
fatty
sugar
fried,
crash. Okay.
Magka-crash ka siguro kung mas stuck ka pa sa traffic for the
Yeah.
next 1 hour or 2, di ba?
Okay.
Pero kung sa akin yung like fatty or deep fried, kasi it will drag yung carbohydrates. I don't wanna be too
Yeah.
technical. Fatty food will, papasin mo parang hikab ka ng hikab.
Oh, yeah.
It will slow you down.
Okay, carbs, like a lot of rice. Yeah.
So, okay pa nga sa akin yung carbs, but if pwede ka lang magdala siguro, slice yung fruits.
Yeah.
Not something too much instead of chips.
Yon, guys, diba?
Yeah.
If you really want to shed some pounds, avoid the chips or anything super fried.
Chicheria.
Oo.
Pero yung
Prutas.
nga, if favorite mo yung banana or apple, ano naman yung 2 minutes, diba? Baunin mo sa car, slice mo.
Yeah.
Para kapag gutom ka, alam mo na meron kang, parang, may sa temptation, di ba? May shield ka eh.
Saka, Coach, diba, one banana is enough to give you like enough energy. But diba,
Yeah.
there's a scientific study na isang banana kaya ka na mag-workout or something.
One banana can sustain your energy for like 90-minute workout or even a run. 5 to 10K run. Marami akong clients na nagra-run. Before the run, I tell them to eat their banana 30 minutes before, 15 to 30 minutes.
Okay.
Mabilis yan ma-metabolize and then ma-convert to energy.
Coach, how to reach you, Coach, from girl? I just checked IG ni Coach Mark. Ano ang IG niya? Ano daw ang IG mo, Coach? And you know, Coach is here until June. Ano na ba?
Till June 9.
Till June 9.
Yeah.
But like when you're here, where's the gym? Where in BGC?
I have a gym in BGC.
Yeah. Okay.
In 4th Ave. It's Anytime Fitness 4th Avenue. So if you have time, you can drop by or message me. Maybe you can set like an appointment or design a program for.
Yon, before he leaves, because again, he's flying back to Melbourne. Diba? I mean, I think it's so much better to do the consultation.
Yeah,
Diba?
face-to-face.
Face to face.
Especially may dun we have the body impedance analysis machine. So,
Ano yun?
Like
Yung-
body composition.
Yung mga kung ano yung mga body fat
You can
gano'n.
know, mas maganda na meron
Coach-
tayong reference.
IG mo daw.
It's Gymbassy. It's GYMBASSY. Instagram. I only have Instagram.
And then, Coach, isa pa. Skipping breakfast. How do you believe in that? Skipping breakfast, is it really that bad? Like some people will just like have coffee and then, diba?
Yeah.
As a personal trainer, how important is breakfast? Because I also read an article about like why they say pinauso yung breakfast.
Yeah.
But as a personal trainer, what is your take on skipping breakfast?
Iba-iba kasi. Ang masasuggest ko if your work, say starts at 11 or 12, hindi na talaga siya breakfast, lunch, or dinner. I would say meal 1, 2,
Brunch
or 3.
na to.
Yeah. Pwede ko sabihin meal 1, 2, or 3. If you skip your breakfast, ang nangyayari is pwedeng down yung energy mo syempre sa morning, di ba?
Okay.
Ang benefit nun, you lose weight kasi you suppress yung appetite, tapos mangyayari niyan, onti yung kakainin mo all throughout the day. Ang downside sometimes, pagdating ng dinner time or yung, say lunchtime, gutom na gutom ka na eh.
So, mas madami kang
Right?
lalafangin.
Mas marami. So, akala nila, I skip breakfast. But at the end of the day, pag in total calories na kinain mo, mas
Ganon
marami
din.
pa. So, there's no right or wrong answer. If you eat breakfast or not, what works for you, mas gusto ko yung kung saan mo tingin ka mas
Magbe-benefit.
Yeah.
Oo.
Or functional ka. Kung ang work mo starts at 8,
Oh my gosh.
having your breakfast at 7 will benefit you kasi 8 pa lang, di ba? If you feel like 11 or 12, beneficial sa'yo. Or, best example siguro, call center agents. Pag out nila ng 6 a.m., magbe-breakfast pa sila, patulog ka na, di ba?
Ayan o, si Princess Sue, or skipping breakfast, skipping dinner. Diba? Paano may nag-interpret?
Princess Sue?
Princess Sue, yeah.
Ate ko yata eh.
Hi ate. Ano kaya ate. And girl says, thank you. I'll try to drop by din sa Anytime Fitness. Come on, do it.
Sasagutin ko na lang ate pag uwi.
Pero coach, how about intermittent fasting?
Intermittent fasting.
Did
pwede
you
siya
ever follow anything?
Like 16-hour fast and then 8-hour restrictive eating din yan eh. What happens is, pwede ka mag-create ng deficit. But, at the end of the day, nga, di mo rin talaga nako-compute ilan yung kinakain mo eh. So, pwede rin, might work for you or might not work for you.
Yeah.
Ikaw yung mas kilala mo yung body mo eh. So, keto, intermittent fasting, we have the carnivore diet, plant-based diet.
Dami, coach.
Ang main goal lang naman natin dyan is to create a deficit. So if your body can, yun yung sasabi ko na we can analyze sa gym. If your body can, say, metabolize or kailangan ng requirement ng body mo na 1,800 calories a day for you to function. And if you eat 2,500, that's 700 calories over. Kahit naka-intermittent fasting ka ba, but you consume 2,500, magigain ka pa at the end of the month. So makakonfuse ka, naka-IF naman ako ah. So, yeah, medyo technical lang yung part na yan. But
Wow.
you get my point.
Yeah,
Diba?
oo.
So,
coach, if since si ate girl pupunta na daw sa Anytime Fitness, if finally I say I brave the commute and make it to Gymbassy, what's waiting for me there sa Anytime Fitness? Is it just for the fitness elite or can I come in my beginner belly? Pwede ba yan?
yeah.
Coach, laki na puson ko. Pwede naman palitin to.
Different from beginner naman to intermediate or even yung may mga pro runners ako na natitrain. Any goal, I can work with you as long as kaya ko. I think scope covered pa rin siya ng naaral ko. As compared sa
Oo nga, since wait, you moved to Melbourne, right? When did you make that move?
back in 2016.
2016. And then you said nag-aral.
Yep.
Sa Melbourne ka na rin you got your credentials
I have to study again kasi you couldn't just, go to the gym and then mag-train ka lang.
It's a different system, yeah. Okay.
So I studied for a year and then I got my cert 3 and 4 in fitness.
Nice.
Under Australia Fitness Academy.
Nice. Wow. Paano naman pag lazy talaga ako mag-workout? Dreezy, parang coach, paano naman daw ako talagang lazy siya? May pag-asa pa ba yung mga katulad namin?
Ang maganda nga sa kanya, alam niyang lazy siya eh. At least kailangan mo na i-address eh. Alam mo, diba? Okay. Start with 1 or 2 workouts in a week. And then from there, mag-increase ka to 2 to 3. Start with baby steps. Do something that you love. Yung na-enjoy mo. Wag muna yung overwhelming na like high rocks, kaya example ng training or CrossFit.
Or HIIT, mga ganun.
Medyo ma-overwhelm siya, baka hindi siya bumalik eh.
Coach, anything coming up, like programs, promos, or events while you're here? You're here for like less than a month?
Yeah. I still have like 2 weeks left. Right now, ang priority ko is I meet my online clients. Yeah, kasi overseas, some of them hindi ko pa talaga na-meet. So I make sure na I get to establish that relationship.
So when you're here, you really tell them, hey, I'm coming, I want to meet you. Why?
Yes, I have to.
And how many, okay na ba? Nasa ilang % na? Okay na? Pwede ka nang bumalik ng Melbourne?
Almost done.
Nice.
Pero if meron akong ma-accommodate pa, like from, baka may makuha inquiries, I'll do my best to accommodate you guys.
Ayan. So again, you can download the app. Promote the app, Coach. Come on.
Yung app, tingin na kasi it's by invite only.
Oh, by invite.
Yeah,
okay.
It's by invite only.
Okay, let's go to Michiko's question. How can you heal or reduce diastasis? Diastasis recti? What recti? What's that?
How can you reduce? I think sana yan eh.
Ano mo na yun?
If you just gave birth, that's where yung abdominal muscles natin, it separates.
Oh my gosh.
Yeah, it might take time. May clients ako na 6 months or 12 or 18 months before mag-heal completely.
Wait, so naghiwalay? I mean,
yeah, kasi when
did
you
it
give
tear?
birth, it has to give, magbibigay siya ng space for the baby. So abdominals ng mga pregnant, when they get to 7th month, maybe 3rd trimester, nagsiseparate yung abs eh. Yeah.
Oh my gosh. And then babalik din naman ulit yan. Because I've seen like, oh my God, you know Brooke Burke. I mean, she's just like this. Hello, she's 5 kids ba? Diba? Tapos may abs pa rin siya. It's not fair.
It will take time, but start with pelvic floor activation or core exercises.
Okay.
Wag muna natin lagyan ng load, but eventually, maybe it might take a year or close to a year.
So patience. Patience
Yeah,
is key,
the status
Mitchie.
rep, yep.
Oo. And again, how can they find you? Social media, Coach, before I let you go. Thank you so much.
Thank you,
And
Tina.
I hope
it's
to-
Jimbasi.
There you go.
I only have Instagram.
Yan.
And I'll do my best to reply kung may mga questions sila.
Yes.
I still have 2 weeks nga. Sabi ko, if you want to visit Anytime Fitness, 4th Ave BGC.
Oh my gosh, come on, you guys.
You
He's
can
not
set an
here
appointment and,
every day. Exactly. There you go. Thank you so much, Coach Mark,
Thank you,
for
Tina, for
coming
having me.
over.
Yeah.
And we do hope to have you back. When you're back, you make sure. Kala mo naman kaya to. Make sure you let me know, Coach.
Yeah.
But oh my gosh, yeah. I hope you guys learned a thing or two on Healthline for this week's episode. Thanking Doc Jonas Apostol and again Coach Mark for coming over and sharing your thoughts with us. Hang on tight for the boys. It's a Wednesday. Tina Ryan saying bye. Catch me back on Friday Madness. Bye, Coach.
Bye. Thank you.
Magic 89.9.